Hey everybody, and welcome to another lecture from CyberMD. Today we'll be covering maneuvers and murmurs, where we will be discussing how different physical maneuvers can affect the intensity of different heart murmurs. This is an important topic to master as it will help you to identify and diagnose murmurs during your physical exam and on the USMLE STEP 1 exam. First, let's discuss the maneuver of standing. When a patient stands, gravity causes a decrease in venous return to the heart, which leads to a decrease in left ventricular volume. This decrease in left ventricular volume can cause an increase in the intensity of murmurs such as mitral valve prolapse and hypertrophic cardiomyopathy. In mitral valve prolapse and hypertrophic cardiomyopathy, the decreased left ventricular volume can be translated into less pressure in the left ventricle. That's how I want you to think of that. Increased left ventricular volume and pressure in mitral valve prolapse helps to open the aortic valve, while the same factors in hypertrophic cardiomyopathy help with ventricular filling. A decrease in volume or pressure makes it harder for the heart to achieve these things when mitral valve prolapse or hypertrophic cardiomyopathy is present. On the other hand, most other murmurs see a decrease in intensity when a patient stands, as there is a decrease in the amount of blood flowing across a stenotic or regurgitating valve. Next, let's discuss the Valsalva maneuver. The Valsalva maneuver is performed by having the patient take a deep breath and hold it while bearing down as if they were trying to have a bowel movement. This maneuver increases intrathoracic pressure and causes a decrease in blood flow to the heart. This decrease in blood flow causes effects identical to standing, as there is a decreased preload and subsequently decreased left ventricular volume. The passive leg raise is a maneuver where the patient is lying down and the lower limbs are raised passively by the examiner, not by the patient. This maneuver increases venous return to the heart as gravity drains the legs of blood, which leads to an increase in left ventricular volume. This increase in left ventricular volume can cause an increase in the intensity of murmurs caused by regurgitation or stenosis, as there is more blood flowing across the valves. Murmurs of mitral valve prolapse and hypertrophic cardiomyopathy, however, will decrease in intensity due to the expanded left ventricle volume, as we just covered. Next up is squatting. Squatting is another maneuver that increases venous return to the heart, which leads to an increase in left ventricular volume. In addition to increasing venous return, this maneuver also increases afterload, further contributing to the increase in left ventricular volume. The effects of this maneuver are the same as the passive leg raise, with murmurs of regurgitation and stenosis increasing in intensity due to the increased blood flow across the valves, while murmurs of mitral valve prolapse and hypertrophic cardiomyopathy are decreasing in intensity. Next is the hand grip or squeezing maneuver, and it's performed by having the patient make a fist and hold it for several seconds. This maneuver increases the afterload and therefore increases the backwards flow of blood volume across the aortic valve. This backwards flow will increase left ventricular volume. This increase in left ventricular volume will intensify left-sided murmurs such as ventricular septal defects, aortic regurgitation, and mitral regurgitation. Aortic stenosis actually decreases in intensity during this maneuver, as the increase in backwards flow decreases the pressure gradient across the stenotic valve. I'll say that one more time. Aortic stenosis actually decreases with the hand grip or hand squeeze maneuver, because the increase in backwards flow decreases the pressure gradient across the stenotic valve. The increase in left ventricular volume in this maneuver will also decrease the intensity of murmurs from hypertrophic cardiomyopathy and mitral valve prolapse. Lastly, inspiration is a maneuver that decreases intrathoracic pressure as the diaphragm expands to create a negative pressure, causing an increase in blood flow to the right side of the heart. This negative pressure simultaneously decreases return to the left side of the heart. This phenomenon increases most right-sided murmurs due to the increased right heart volumes and decreases most left-sided murmurs due to decreased left heart volumes. It is likely that the murmurs of hypertrophic cardiomyopathy and mitral valve prolapse would be increased in intensity with this maneuver, secondary to the decreased left ventricular volumes. In conclusion, understanding how different maneuvers affect the intensity of heart murmurs is an important skill to master for the USMLE STEP 1 exam. By understanding which maneuvers increase or decrease the intensity of murmurs caused by conditions such as aortic stenosis, mitral stenosis, hypertrophic cardiomyopathy, and mitral and tricuspid regurgitation, you will be able to better identify and diagnose these murmurs during your physical exam as well as on the Step 1 exam. It's important to keep in mind that these maneuvers are not diagnostic on their own, but they can help to confirm or rule out a suspected diagnosis. Always keep in mind the patient's symptoms, medical history, and other physical exam findings are key when interpreting the results of the maneuvers. It's also important to note that these maneuvers are not always safe or appropriate for all patients. Always use your clinical judgment and consider the patient's safety and comfort before performing any maneuvers. By understanding the cardiovascular changes that occur with each maneuver, you will be better prepared to ace the USMLE Step 1 exam. Thanks for listening, and be sure to subscribe to our content.